All right, I would like to welcome everyone to our third installation of our Alabama Aging Resources Workshop. Thank y'all so much for joining us today. Today we've got a really great and informative workshop. All of them are, but I think this one's really, really particularly interesting. So I am going to introduce you to one of our volunteer leaders, Ms. Gloria Burks. She is going to be introducing our guest today and telling you a little bit about AARP. So Ms. Gloria, thank you so much for being here and take it away.
Hi there, I am Gloria Burks, AARP Alabama volunteer leader, and I would like to welcome you to this presentation. AARP empowers people to choose how they live as they age. AARP is a nonpartisan 501c4 that has over 420,000 members in Alabama. AARP's role is to advocate for those 50 plus and their families, regardless of politics. A few things before we get started today. Please keep your microphone on mute. If you have a question for the presenter, please add it in the chat box. Please be aware that this presentation is being recorded. Again, thank you so much for attending today. Now I'd like to welcome our presenter, James Roberson, MHA, is the Regional SHIP, SMP, and Senior Prescription Coordinator with the South Alabama Regional Planning Commission Area Agency on Aging. He is a graduate of Alabama A&M University and the University of Phoenix with degrees in biology and a master's of health administration. Welcome, James, and thank you for presenting for us today.
Thanks for having me, Ms. Gloria. Appreciate the opportunity for being here this morning. Okay. So what we would like to do this morning is kind of go over some of the slides that we have here to share some information with the community at large as to what the state health insurance program is, along with the Senior Medicare Patrol, and as well as SenioRx. Next slide, please. Okay, so I'd like to begin by talking about SHIP. The question is, what is SHIP? And SHIP stands for State Health Insurance Assistance Program, and it provides free help to people with Medicare. It also provides public presentations and private one-on-one counseling. SHIPs are funded by the Administration for Community Living and administered by the Alabama Department of Senior Services. The program has committed volunteers and community partners to assist beneficiaries throughout the SARP-C region. Not only the SARP-C region here in Mobile, Baldwin, and Escambia, but throughout the state of Alabama. We cover all 67 counties throughout the state. And also we cover every county in the United States of America. So there's a SHIP office that covers every single county across the country. I'm specifically working in the Mobile, Alabama, Baldwin County area, as well as the Escambia County area. Next slide, please. Okay, polling time. Just curious, how many people have ever heard of SHIP? You don't mind just kind of giving us an idea of people. A lot of times, a lot of people are not really familiar with the program, so we like to try to kind of figure out. Okay, all right, pretty good, 86%. Okay, all right, okay, good deal. All right, next slide, please. All right, so I'm going to explain a little bit about what SHIP can do for you, or how we help people across this country with Medicare insurance. We basically help people at a local level. That's the mission of SHIPs. We are designed to provide Medicare counseling services to beneficiaries, their family members, or caregivers at a local level, so that people have a free, unbiased place to go to get help as they run into issues with Medicare. We also provide assistance with Medicare prescription drug plan benefits, Medicare Advantage plan benefits, Medigap policies, also known as Medicare supplemental benefits. Coordination of benefits is a really big deal. A lot of people are working up to that 65th birthday, or some are working over their 65th birthday. And they oftentimes have questions as to how do they coordinate their retiree services or their retiree benefits with Medicare once they decide to leave their employment group, right? So we provide a huge benefit for HR departments across the region, across the country for that matter, as to helping their former employees coordinate their Medicare benefits with their retiree benefits. We also assist with appeals. A lot of people have issues with billing and appeals on decisions that they feel like should be covered that may not be covered. We assist people with filing for those appeals, things of that nature. And lastly, we also assist with cost-saving programs. So ultimately, your local SHIP is a program that helps people make informed choices about their health insurance options. Next slide, please. The next program that I coordinate is called SenioRx. Now, this program is a free or low-cost prescription drug assistance program. And basically, we ask the question, are you struggling to find money needed to pay for your prescription medications? Do you need help in obtaining prescriptions? Then we are ready to assist you through what's called the SenioRx program. And basically, this program is a program for Alabamians who are age 55 and older, and for persons with disabilities who are diagnosed with chronic medical conditions requiring daily medications. Since its inception in 2002, the program has saved thousands of Alabamians millions of dollars in medication expenses by providing this free or low-cost prescription drug assistance through pharmaceutical manufacturers. Next slide, please. Polling time again, just curious, we like to find out how many people have actually heard of these programs before. So we're asking the question again, have you ever heard of SenioRx? Okay. Give a minute to get those results in. And okay. Okay, all right. So this one is a no. Most people haven't. We're almost roughly 70-30, right? So, okay. So I'm going to explain a little bit to this group about SenioRx and what it does. Next slide, please. So, okay, so this slide, I'm going to just explain to you a little bit about what the program is and kind of how it operates. And basically, the SenioRx program aims to help people manage their chronic illnesses earlier and prevent more serious health problems later in life. People who qualify for SenioRx receive a 3-month supply of prescriptions from various pharmaceutical companies free or at a low cost and can be renewed as long as the person is eligible. Now, to qualify for this program, you must be at least 55 years old with a chronic medical condition, have no prescription drug insurance coverage, and must meet certain income guidelines. Social Security disabled individuals who have applied for disability or have a doctor's declaration of disability who are in the 24th month Medicare waiting period are also eligible for medication assistance, regardless of age. This medication assistance allows individuals to utilize their limited income for food and other important expenses. I do want to mention on SenioRx, sometimes being underinsured qualifies as well. So there are some people who have prescription drug coverage, but it may not cover a particular drug. So we don't want to discourage people. We want people to call us if your insurance that you have is just not meeting the needs. We would consider you underinsured. So we would still like to talk to you to go over these options to see if we can assist you with medication prescription drugs through our SenioRx program. Next slide, please. Okay. The next program is called the Senior Medicare Patrol Program. Now, the Senior Medicare Patrol Program is housed within the Alabama Department of Senior Services. The Senior Medicare Patrol Program is a preventative educational program whose goal is to reduce Medicare error, fraud, and abuse, through statewide coordinated efforts of educational and promotional activities to encourage the reporting of discrepancies by Medicare beneficiaries and caregivers to the Senior Medicare Patrol Coordinator located in Alabama's 13 Regional Area Agency on Aging and Disability Resource Centers. Protect, detect, and report is basically the Senior Medicare Patrol's slogan. Next slide, please. Another polling. How many of you have ever heard of SMP? Give you a second or two to answer those questions. And okay, all right. Almost the same as SenioRx, pretty much 75-25 this time. 75% saying no. Okay. All right, next slide, please. All right, so some SMP current trends. You know, our Senior Medicare Patrol Program is we basically work with beneficiaries and caregivers to educate them about Medicare benefits and also Medicare statements related to those benefits. So basically what we're dealing with is trying to teach people to understand their Medicare summary notice or their Medicare Part D prescription plan explanation of benefits and other healthcare related statements. A person can identify, resolve, and or report possible billing errors, fraud, and abuse and waste to their local ADRC, which is our Aging Disability Resource Center, at 1-800-243-5463. Our local number in the Mobile, Baldwin, and Escambia County area is actually the 251-706-4680. So the best way for me to explain the Medicare summary notice to people is to educate you on what it says. It has a very popular tagline at the top of a Medicare summary notice. And what it says at the top of these forms, they come from the Department of Health and Human Services. And at the top, most people recognize these forms because it says, "This is not a bill" at the top, right? So when people see "this is not a bill," you know, like my mother would do, she would take it and say, "Well, good, I'm glad I don't have to pay that." And she would throw it away, right? And what we want to do is we want to educate people on actually not doing that as much and taking a look at that actual bill and seeing if those things that were billed to your account, even though you don't have to pay this, we want to make sure that someone's not fraudulently using your Medicare number to bill for services that you did not receive. So that's what we want. We mean about detecting these issues. You have to look at these notices because, especially now with so much remote virtual online type services that are being offered, there's a lot of misinformation out for things such as billing for services or supplies not provided. You know, a lot of people now are being called on the phone and they're being told that, you know, if you give me your Medicare number, we can skip you in the front of the line for a COVID-19 vaccine. Or if you give me your Medicare number, we can get you your scooter, walker, wheelchair mailed to your house. You know, so all these type of trends are kind of happening right now with testing sites. With COVID-19 created a nightmare for a lot of our Medicare beneficiaries with duplicated payments, ordering unnecessary lab services. You know, all of these things have been done. So we want people to protect themselves by, number one, not giving that information out over the phone, especially on an inbound call. If someone calls you, our rule of thumb is not to give that information up. Only give that information up if you're initiating the call, because you know there's roughly $60 billion with a B that's being stolen from the Medicare program, which affects all of us. So it's very important that you protect yourself by not giving out the information over the phone, that you detect issues by actually looking at your Medicare summary notice or your explanation of benefits. And also check the dates. Sometimes the medical jargon on those summary notices can be kind of confusing. So what we encourage people to do is, you know, check the dates. Did you go see that doctor? Did you go see that specialist? Did you receive that item on the date that's on that summary notice? If you did not, or if something looks suspicious on these notices, we're asking you to give us a call, you know, so that we can help you investigate this. We can get this information reported. You know, it could be a simple error. Sometimes there's just errors. You know, sometimes people code it wrong or it's billed wrong to the wrong service by mistake. But what we would like to do is we would like to just make sure that's the case versus you being fraudulently attacked for your Medicare number, because ultimately it makes the prices go up for all of us. So next slide, please. Okay, all right. So these services here I'd like to talk about here next are programs that we spend a lot of time with the state health insurance program, as well as Senior Medicare Patrol, and even SenioRx for that matter. And these are services that we, you know, hold very near and dear to us, because we basically are screening people every time they give us a call to see if they're eligible for ways to save money while they're on the Medicare program. So with that being said, you know, when people call us, the SHIP or our Aging Disability Resource Center, we basically aim to screen every beneficiary to determine their eligibility for low-income assistance program and the Medicare Savings Program. So Extra Help, also known as low-income subsidy, is a subsidy program that's actually created through Social Security to assist people with their Medicare prescription drug costs. So currently, in order to be eligible for this program, a person's gross monthly income, if they're single, has to be $1,630 a month or less. That's total gross income, okay? And if you're a couple, it's $2,197.50 a month. And resources are counted because this is a federal program. The Extra Help program is a federal program, which means they're going to count your resources. So those resources for a single person is roughly about $14,000 in savings. If you have anything more than that in stocks or CDs or savings, then your resources would be considered too high. If you own any other property outside of the home that you live in, that would be counted as a resource. If you're married, that would be that number would go to about $27,000 between the two of you in monies. If you have any type of, you know, savings or anything in the bank that's over that, that's gonna, if it's over 27,000 or so, that's going to be a resource that they would consider too high. So in this particular program, if you have this income limit and or your resources are under the limits I just mentioned, you're more than likely eligible for this program. Now, the other part about extra help that's really important, you don't get anything tangible. So in other words, they don't send you an actual card that you take to the pharmacy. When you're eligible for extra help, what happens is whatever prescription drug plan that you're currently on through Medicare, that drug plan card is flagged. So when you swipe that card at the pharmacy of your choice, what happens is the subsidy will be added to whatever the cost is. So basically, for generic medicines, your medicines will be roughly somewhere around $8 and change, close to $9. And for for brand names, your medicines will be about $8 and change. And for generics, your medicines will be about $3 or $4. So most people are familiar with that. Now, it doesn't matter what the med costs. If your medication's $300, if you're on extra help and the plan covers that particular drug, the plan that you're on, the actual prescription drug plan, if it covers that drug and you're on extra help, that medicine may scan at first at $300, but then you'll only pay $8.40 for it. That's the benefit of extra help. If it's a generic drug, you'll pay about $3 or $4 for that medicine. So most people that are on extra help are very familiar with what they pay. That's how we kind of find out if they're already on it, because some people may not have anything to show that they're on it. Their card is flagged. They will get a letter of approval from the Social Security Administration that says you've been approved, but that's all you get. You don't get anything that you actually take to the pharmacy, but you will see the reduction at the counter, and most of your medicines being $3 or $4 for generic, roughly $8 or $9 for brand name. Very, very substantial program when it comes to assisting people with the high cost of prescription drugs. It averages roughly about $5,000 in savings a year for most people that are on it. And then some people even more than that. The other program I'd like to mention is the Medicare Savings Program. Now, this program is a state program and it varies depending what state people live in. In the state of Alabama, this program is ran by the Medicaid agency, right? So Medicaid, Alabama Medicaid, basically pays the monthly Part A and or Part B premiums for people. So when you go on to Medicare, you have a monthly premium of roughly right now, it's $148.50 for most people on Medicare to get Medicare Part B, right? That's your medical coverage, covers your doctor's appointments, labs, x-rays, CT scans, outpatient procedures. Medicare Part B covers these at what's called an 80-20. So 80% Medicare picks up, the other 20% you would have to pay out of your pocket. Well, Medicare charges $148 a month to every Medicare beneficiary. Well, people with limited income, if you're in the state of Alabama and your monthly income as a single person is $1,469 a month or less, and as a married couple, if it's $1,980 or less, you're eligible for this program. Now, this is a little different than the federal program because the federal program, it states that resources are counted. In this state program with Medicaid, resources are not counted. So in other words, as long as your monthly income does not exceed these limits, you can have as much money as you want to in the bank, or you can own other properties, and those resources will not be counted towards you, which is really confusing for a lot of people because traditional Medicaid does not work that way, right? But this Medicare Savings Program, which is different than traditional Medicaid will count resources. Medicare Savings does not count resources. So in other words, you can have a significant amount of money in the bank. You can have, 20, 30, 40, 50,000, $1 million in the bank. If your monthly income is $1,469 for a single person, or you're married and you and your spouse have $1,980 and that's your income monthly, then you're eligible for this Medicare Savings Program. And what that means is your Medicare Part B premium will be paid by the state. So they will not take that $148 a month out of your Social Security check. The state will actually pay that for you. So that's an immediate savings of $148.50 per month. Next slide, please. Okay, so, this is just a slide to go over a little bit about how these programs and services affect our community from a health and economic standpoint. So this is just some numbers just to kind of share with you all a little bit. Now, these numbers are kind of specific to the Mobile, Baldwin, and Escambia County region. And I do realize these services are provided throughout the state. So we have other agencies throughout the state that provide the same services that we provide. But these numbers I want to share with you are regional numbers for our area down here in the Mobile, Baldwin, Escambia County area, just to give you a little idea of the impact of these services. So last fiscal year, we basically served 7,693 people through our state health insurance program service. So basically our counseling service. With our volunteers, our ADRC help, our in-kind support over in Baldwin County and Escambia County, our partnerships with community partners, whether they are faith-based organizations, whether they're civic groups, they all assist us with reaching that number. We always want to reach more, but that's what we were able to reach in the Mobile, Baldwin, and Escambia County area for seniors and people with disability. The next bullet point, though, shows that we enrolled 477 people into that extra help or low income subsidy program last year. So that's the prescription assistance program that assists people with paying for their medicines with the income-based program I mentioned earlier. So for us, we would like to enroll more. The problem is not very many people have heard of extra help. So we're depending on the community, we're depending on our partnerships to assist us with educating them on this program. We want this number of people enrolled to look much higher as we continue to assist people in the community. We want to make sure that we're able to enroll as many people as we can. But with that number, with those 477 people, we were able to save over $2.3 million on Medicare prescription drug costs last year. So just off of those 477 people in the Mobile, Baldwin, and Escambia County area alone, we put $2.3 million back into the economy, where these people weren't spending it necessarily at the pharmacy counters, but they had that money to do other things, whether it was to buy groceries, help grandkids, provide infrastructure for their homes, go on vacations, whatever they needed to do. That was $2.3 million. We feel like we can really save much more than that, but we need help educating the community on the fact that these programs exist. There's several people that are out there that are eligible but not enrolled. Okay, for Medicare Savings, the Medicaid program, we enrolled 498 people under the Medicare Savings program last year. Again, we assisted roughly 7,000. So, we want to make sure that we're getting as many people enrolled in Medicare Savings as well. But with that, we still saved over $887,000 on Part B premium payments, just off of those 498 people. So we're really excited about the future, knowing that there's so many more people to help, but we also are excited about what we've already accomplished, So SenioRx, with that outreach, basically SenioRx, just to kind of put a cap on this a little bit as well, I want to explain the difference between SenioRx and Extra Help. SenioRx is available for people who don't qualify for Extra Help, right? So they're the next step up. So we realize not everybody is going to qualify for Extra Help because of their income, but they still may have trouble paying for medications. So the SenioRx program is designed to help those people that are not eligible for Extra Help. And in SenioRx, we actually were able to help we helped get over 13,000 medications out last year through our SenioRx program. And roughly, we saved seniors and people with disabilities in our area over $5.6 million on SenioRx programs last year. So as you can see, there's a huge benefit to being on these programs. Number one, from a health standpoint, it's healthier. Our seniors and people with disabilities are able to access their medications. They're not borrowing medications. They're not breaking pills in half and sharing medications. They're actually able to have access to the medications that they need and also be able to take care of themselves in other ways, whether it's through their food and the other things that they need when they're home. They're saving that money. And also from an economic impact, it's actually money that they're saving and can put into our economy in other areas to help benefit our economy in other areas versus spending that money on at the pharmacy counter. Next slide, please. Okay, so that was the last slide that I had. I just wanted to make sure that everybody knows that obviously this is our local contact, but we do realize we're speaking to the state. So from a state standpoint, in order to get in touch with anyone that in the state that with people that do what I do across the state of Alabama, that 1-800 number is applicable to each of you. If you're looking for these services, all of these services are available in every county in Alabama. So what we're asking people to do is, if you're looking for assistance with these services, feel free to call that 1-800 number. If you have any questions for me in the future, of course, our aging disability line is there, and that's my personal email on that slide as well. And I'm open for any questions or anything like that. I appreciate you all for giving me the time to share this information with you, and I look forward to answering any of your questions.
Great. Thank you so much, James. We really appreciate it. We do actually have a really good question from Abby in the chat. She asked, does the SenioRx program cover or provide insulin options for qualifying folks?
Yes, ma'am. Absolutely, they do. Absolutely. Yes.
Excellent.
Yes. Great question.
Excellent. Yeah, that is a great question. My dad is a type 1 diabetic, and he takes insulin several times a day. So that is a very, very, very relevant question. And I also, James, I didn't say this in the beginning, but I wanted to thank you and your colleagues for all you do. I know that y'all have a huge job doing, managing all these programs. So
thank you.
Yeah, thank you. And I have to give a shout out to Abby, who asked that great question. She answers the 211 line, and she said she gets a lot of questions about that. So okay. I have to give her a shout out too, because she's got a big job, but that was a great question from her.
It was, and insulins are an issue. When President Trump was in office, he initiated some things to try to assist people with those, with some pharmaceutical programs under prescription drug plans have decided that they would cover some insulins at $35. But not all of them do it. So, it's kind of the luck of the draw with some people.
Right.
It depends on what you take. But with SenioRx and Extra Help, those are two viable options for people in our area to get assistance with those two issues.
Absolutely. Absolutely. So thank you, James. And yeah, I know just from a AARP standpoint, we are a 50C14, which means we are mostly advocacy as well as this type of outreach stuff. But one of our big federal fights is to lower prescription costs for everybody and to always protect Medicare, Medicaid, and Social Security. So we are fighting the good fight with you, James, here. But I just think it's so great that these are all free. You can call and find out, right? Just
Sure.
Give everybody a call. And I'm going to put up the sorry, my mouse keeps. There we go. This is the 1-800-AGE line number. And you can call this number. If you have a landline, it'll take you directly to your agency. If you have a cell phone number, you can still call that line. If you're calling from a cell phone, you just tell them which county you're in. And somebody asked, can we get a copy of the PowerPoint? We're actually recording all of these. And we will be sending you the link once I get them edited and uploaded to YouTube. I will send everyone who's registered a link to rewatch this. But I am going to put in the chat the 1-800 number right now, so you have that. And then also, if you are looking, the Alabama age line, I'm gonna put that in the chat too, but alabamaageline.gov in general has all of this information, and you can also, and this is also where you can find your AAA locator. So if you are anywhere else in the state, you can go online here to alabamaageline.gov. I'm sorry, y'all, I'm typing this in as I say this, /AAA-locator. And that will actually provide you with the map. So you can just scroll over the map and find your area agency on aging. So it's really easy. And again, you know, James is here for Mobile, Baldwin, and Escambia counties. And he mentioned the Alabama, you mentioned the Aging and Disabilities Resource Center. And our guest last week, Christina Boynton, talked all about the ADRC. And we're going to have that recording up on YouTube pretty soon. So I will send y'all that link as well. It just takes a little bit for me to figure out the technology on that, folks. Sorry, I'll get faster at it and better at it as we go along. But we'll definitely have that recording up very soon. James, I really thank you today for everything. This was a lot of information. And do you mind if I put your email address in there for folks?
Not at all. Not at all.
All right, James, it's jroberson@sarpsy, right?
That's correct.
All right. sarpsy.org. Is it .org? sarpsy.org? Okay. Sorry, for a second there, I had lost my mind. So I put James's email address in the chat in case anybody has any questions for James. You know, again, James, I really do appreciate you coming on today and talking about this. And you know, we'd love to have you on again.
Thank you.
You know, maybe in the future, especially when open enrollment. Now, that's usually in October. Is that correct?
That's correct. Yeah,
okay.
Open enrollment is normally in October, and I would love to come on and talk a little bit about some of the issues and things that people need to look out for during that time of year. So I look forward to that.
All right. Yes, we would love to have you back for that, for sure. And next week, folks, we've got the long-term care ombudsman. That's Frank Willis. And he is going to be telling you about what an ombudsman does. And so if you have any loved ones in a long-term care facility, this is going to be a really important presentation for you, because he's going to tell you about advocacy and rights and making sure that your loved ones in long-term care facilities have a voice. So he's there to make sure that they do that. So that's going to be really interesting. And let's see. Oh, and Christina, thank you. Christina is on, our presenter from last week. She says also you can email questions to aginginfo@sarpsy.org to reach the Aging and Disability Resource Center. She put that in the chat. Thank you, Christina. Great information. And then here is a list of our upcoming events. Let's see, our next one's April 8th. That's next Thursday at 11 a.m. I put that up, and I'm going to put up the general website so you can register for all of these. Here we go. So that should be in your chat now. And again, James, I want to thank you so much for coming on today. Let's see, and Miss Gloria, thank you so much, Dorothy and James. As a caregiver, I am so much better equipped because of this presentation. Thank you, Miss Gloria. We appreciate everything you do.
So much.
And yes, being a caregiver for our older loved ones, our younger loved ones, it is always a challenge. And I was along with my mom, one of the main caregivers for my grandmother for 13 years. She had dementia. So I feel you. I completely understand how hard it is. I also understand how rewarding it is, but I'm so glad that we have people like James and Christina and Della and everyone at the Area Agency on Aging and all over the state who can help us with this type of information. So again, James, thank you so much for this. We really appreciate it.
Thank you so much for having me. I really appreciate the opportunity, and we look forward to helping as many people as we can help.
Absolutely. Absolutely. And like I said, we will definitely be calling on you again, especially when we get closer to that open enrollment time. I know we had you on some of our live broadcasts on Wisdom Wednesdays last year during that time, and you taught me some things I didn't know. So that was some really good information, and just looking forward to continuing to work with you, James. Thank you so much.
Thank you so much. You all have a great day.
Okay. All right, everybody. Thanks again for joining us. I will email you with the information as soon as I get this uploaded. It might be a week or two, but I'll get this recording uploaded for you and send it out. So everyone have a wonderful, wonderful, if you celebrate Easter, have a wonderful Easter. If you have spring break, have a wonderful spring break. And we will catch you next Thursday at 11 a.m. Thanks, everyone.
Thank you.